Hello, I'm Alice. So this video is going to go over the essentials to pack in your hospital bag for both you and your baby. It is important to remember that this video just goes over the basic essentials and things may differ from trust to trust. So it's important to check with your midwife or any healthcare professional if there's anything specific that you need to pack for your hospital. Okay, so first things, you are going to need a bag or a little suitcase. Please don't bring your cat. Cats are not permitted in the women's centre. I'm really sorry. It's useful to have one for you and also one for your baby, and a good tip is to try and pack light. Hospital rooms and bays are not the most spacious places in the world. So for you, you will need some comfy clothes and pyjamas, an oversized top or a nightie are really useful for labour, and then some comfy pyjamas or leggings or a top that isn't too tight are really nice postnatally. Even a dressing gown or something that's comfortable and is going to bring a little bit of home to the hospital. Especially at the moment when visiting is restricted on the hospital wards. Cool. Also bring some big comfy pants as well. The hospitals provide some one size fits all netty knickers, but sometimes it's really nice just to have your own granny pants. Hospital provides maternity pads as well, so you don't need to bring those, but it's really useful to have them at home ready, just because you're going to have bleeding like a period for about 10 days and then could have spotting for up to 6 weeks. Cool. So if you are planning to formula feed, it's really useful to bring a tight bra with you as well, just because this is more comfortable for you, and especially when your milk comes in, it decreases the risk of a blocked milk duct, engorgement or mastitis. If you get any symptoms of these, please contact your GP or your midwife. And then next on the list is toiletries. There are showers on most labour wards and postnatal wards, however hospitals don't provide basic toiletries like shampoo or conditioner, so it's really useful to bring those. Lots of women find that after they've had a baby in the postnatal period that a shower just makes them feel a bit better. One thing people always forget are toothbrushes and toothpaste. Go wild, treat yourself, buy yourself a new toothbrush and toothpaste for the occasion. If you're sensitive to light when sleeping, etc., maybe bring an eye mask or something, just to help you feel more comfortable. There isn't really a need for any like hair dryers or straighteners or curlers, etc., or makeup. It's really useful to take the time in hospital just to rest. Next on the list is snacks and drinks. So these are things that don't require heating or storing in a fridge or freezer. You are provided with 3 meals a day in hospital, and any hot snacks or snacks in between meal times if you request on the wards. However, it's really useful just to have some snacks ready in your bag. Drinks. Isotonic drinks are really good for labour, but also so is water for energy. Water is provided at every hospital and sometimes they have squash. It's really useful to have a water bottle with a lid and a straw because you can kind of drink it in any position. Obviously you have tea and toast as well and coffee, but it is NHS tea and coffee, so if you're a bit fussy you might as well bring your own. Probably most importantly, if you take any regular prescribed medication, to bring it with you. This is like outside of like pain relief and stuff. If you have diabetes and you have a blood sugar machine, please bring that with you too. That's really important. The hospital does have one, but it's really useful if you bring your own. So in terms of practical things, your phone is really useful. But one thing people often forget is the charger. Hospitals do have spare chargers, but they're few and far between, so if you have your own, it's really useful to bring it. Another thing with the phone is lots of people like to listen to music or have playlists and stuff in labour. Lots of labour wards and postnatal wards do have speakers or things you can use as well, or you can just play out your phone. Or you can bring headphones too. That's really useful to pack as well, especially if you're having phone conversations on the postnatal ward as well, because sometimes if you're in a bay you don't want 3 to 4 other families listening to your conversations. Music is also really good at calming the mind and brain as well, which is something that lots of women need. Another thing to pack that's quite important is books or entertainment, like tablets and laptops with films on them. Yeah, it's a really good way to distract you and help time fly. Okay, so that's everything for your bag. Like I said before, these are just basic essentials that we use in our trust and have thought of ourselves. There may be things that are personal to you or specific to the hospital or midwife unit that you are planning to have your baby in, which is why it's really important to check with your midwife beforehand. Okay, so moving on to baby. First really important thing is a hat. So it's useful to pack like 3 to 4 hats. Babies lose heat most from their head, especially after birth, which is why we like them to keep a hat on for at least the first 24 hours. A really good tip is to have one hat handy, because your midwife will ask for a hat after your baby arrives, and the worst thing is having your partner or birth partner frantically looking for a hat after your baby's born. Midwives love it when you have a hat and you pop it in the cot ready. You'll also need some baby clothes, just some vests and some baby grows, nothing like fancy. A good number is around 5 to 6 vests and 5 to 6 baby grows. You may not be in hospital very long, but it's always good to be prepared. As I said before, this varies from trust to trust, but as visiting hours are restricted, your partner or someone close to you might not be able to bring you extras. The hospital will provide you with towels and blankets, but you can also bring your own. Remember not to wrap babies up too much, so thin blankets will do. Some people have muslins too, as they are useful for wiping up baby fluids and milk and stuff. Cool. Next is nappies. So hospitals don't provide nappies, but you do need to bring your own. Whether you're using fabric reusable nappies or non-reusable nappies, it doesn't matter. Whatever you want. It's useful just to bring a pack. Babies tend to do 2 to 3 poos a day, and however many wees as they are days old, so like day 2 they probably do 2 wees. Yeah, this pack has 31, I think. I don't think your baby will do 31 wees if you're in hospital for an average amount of time, but it's always useful to be prepared. And then next is wipes or cotton wool. It doesn't really matter what you use. You can use either, it doesn't wipes, whatever you choose. Bring your own wipes if you want to use wipes. If you want to use cotton wool, you can bring your own cotton wool, or the hospital might be able to provide it. The hospital will also provide the sterile water if you're using cotton wool, so you don't need to bring that. If you are planning to formula feed, you don't need to bring formula milk with you. The hospital will provide that, although it is always useful to have some ready at home and tell the midwives in the hospital what brand you're using. So yeah, that's really it for babies. In terms of unnecessary extras that you don't need to bring, a breast pump, unless you really want to. Hospitals can provide you with a breast pump, and midwives or maternity support workers can show you how to use them. And bottles for the breast pump or express milk are provided by the hospital, so you don't need to bring those either. Hospitals also provide syringes for expressing colostrum too. However, if you do express some colostrum at home in pregnancy, you can bring this too, and we can pop it in the fridge for you to use. Also, you don't need to bring your car seat with you if someone's able to pick you up, just because it's kind of safe space. Just make sure that your baby goes home in the hospital in the car seat, and it's checked by a midwife or a maternity support worker. Yeah. Anyway, I think that's it. I think it's important just to note that even if you are planning on having a home birth, it might be useful just to pack a little hospital bag and have ready on just on the off chance that you have to go to hospital at any point. But yeah, thank you for watching this. I hope you found it useful.